Welcome, everyone. I'm Ellen Herman, co-director of the Wayne Moore Center for Law and Politics and professor of history at the University of Oregon. We're so glad you can join us today for a discussion of immunity passports, which are being proposed and tried as one policy response to the global COVID-19 pandemic. This event is part of the Public Affairs Speaker Series hosted by the Wayne Moore Center. For those not already familiar with the center, our mission is to advance the public interest by encouraging civic engagement and dialogue. We bring students, scholars, activists, policymakers, elected officials, and members of communities, people just like you, together. We discuss a wide range of issues affecting Oregon, our nation, and the world. We work in the tradition of Oregon Senator Wayne Morse, who believed that political independence and education were building blocks of justice and democracy. Currently, we are in the middle of a two-year theme exploring science, policy, and the public. Today's conversation is directly relevant to that. We have two very distinguished individuals with us today to speak and answer questions on the subject of immunity passports. We will hear from them for about 15 or 20 minutes and then open the conversation up to you. So feel free to add your questions at any time by using the Q&A button at the bottom of your screens. I'm delighted to introduce Francoise Baylis and Natalie Kofler. Francoise Baylis is a philosopher and university research professor at Dalhousie University in Canada. In 2017, she was awarded the Canadian Bioethics Society Lifetime Achievement Award. She will occupy the Wayne Morse Chair during the 2020-21 academic year, and we are very much looking forward to her month-long visit with us in early 2021. We sincerely hope that she will be able to be with us in person. Most recently, she is the author of Altered Inheritance, CRISPR and the Ethics of Human Genome Editing. Published in fall 2019, before the pandemic, the book makes fundamental points that are all the more urgent in light of COVID. First, we need a kind of slow science that is attentive to the problem of creating haves and have-nots. Second, we must aggressively pursue public education, engagement, and empowerment in relation to science policy. Third, scientists and ethicists play important roles in policymaking. And finally, we must never lose sight of the biggest questions. For example, what kind of world do we want to live in? Natalie Kofler is a molecular biologist and lecturer at the Center for Biomedical Ethics at Harvard Medical School. During her postdoctoral training at Yale University, she used genetic technologies like CRISPR in biomedical research before founding Editing Nature in 2017. Editing Nature is a global initiative whose mission is to help steer responsible development and deployment of environmental genetic technologies and ensure that gene editing technologies are used to the benefit and not the detriment of our planet. She is a leading voice for the advancement of inclusive science, integrated deliberation models, and scientific citizenship. Francoise Baylis and Natalie Kofler co-authored a commentary on the subject of immunity passports that was published in Nature on May 28th, just about a month ago, and they have co-authored a number of other recent pieces on related topics. Francoise and Natalie, thanks so much for joining us today. Can you start us off by telling us first what immunity passports are and explain what prompted you to write about them and share some of your main points on this subject?
So first of all, let me say thank you for providing us with this opportunity to share some of our ideas with a wider audience. That's always a welcome opportunity. What I want to do is start off by just making sure that we're all on the same page when we think about what are immunity passports. And I think the most important thing to understand is that this is something different from what people might already be familiar with, which is a sort of a vaccine document or travel authorization for specific kinds of vaccines that we have. And the ones that people might be familiar with are yellow fever. So if you're going into certain countries, you need to have that record of immunization in order to travel. But an immunity certificate is something different because it's actually not based on a vaccine. It's based on immunity testing. And Natalie will share a little bit more information about that in a minute. But what I want people to understand is, why has this idea been floated? Why are people talking about this kind of a concept of an immunity passport? And the idea has been that this would allow people to get back to work. It would help us to jumpstart the economy, because people who would be presumed to have immunity would be able to go back out into the world, back out into the workforce. We don't know very many details insofar as how this would really work, but that's the basic idea. And what I want people to think about is that this is not just about perhaps jumpstarting the economy, but ultimately it's about controlling movement. Because it could be not just, are you allowed to go back to work, but are you allowed to go back into this social context, for example, a sporting event or a museum. It might also be, as I said at the beginning, related to travel. So this is about controlling movement. And the idea right now is that it would probably be digital, but in some countries that may not have that kind of infrastructure, it could perhaps be paper documentation. So we're looking at documentation to control movement, with the idea that somehow this would constrain the movement of people who don't have immunity to this particular virus. Now, the second thing for people to appreciate is that this is not just some wild idea that a few philosophers or scientists have had, because in fact, different governments have been moving in that direction. Excuse me. One example is China. They've already introduced these virtual health checks, which rely on QR codes on people's phones. And so they can be stopped and asked to provide a copy of their immunity status or health status, depending on how you understand what information is or is not being collected and or presented. Not long after that, we heard that Chile was planning to have some kind of immunity certificate, and there was a lot of pushback against that. And so ultimately they ended up changing the name, and they've called it a medical release certificate. But you're getting the same kind of basic idea or concept. If people are going to be allowed out into the world, they're going to have to be able to provide some kind of documentation. Since then, we actually have digital apps that are being tested in other countries. Estonia is one of them. A number of governments have expressed an interest, such as the United Kingdom, the United States, Germany, and we know of a number of companies in the Silicon Valley that are actually trying to repurpose some of the technology that they already have, for example, in terms of facial recognition, to be able to link identity to health information and thereby provide tools to people for them to be able to constrain the behaviors and specifically the movement of people. Can you come out of lockdown? Can you come out of any bubbles that you're sort of working within and get back to work, get back to your regular social life, get back to traveling? So that's sort of the start. Let me turn it over to Natalie to just share with you a little bit about why we think that from a technical and a practical point of view, this is already wrong-headed. And then I'll come back and talk a little bit more about the ethics.
Thanks, Francoise, for setting that up so well, and thank you again for having us. We feel this is a really important conversation, and we really welcome any time that we can expand who we get to discuss it with. So thank you very much. So as Francoise pointed out, there are multiple companies and countries right now exploring this idea of an immunity passport. In response to those new explorations, the WHO did come out with an announcement on April 24th, basically cautioning against the use of an immunity passport, in that there currently wasn't enough evidence that people who have recovered from COVID-19 have antibodies that could protect them from future infection, i.e. being immune. And really, this was a really sound statement to make, given what we know right now about COVID-19 immunity. And so this is sort of what I wanted to discuss. First are some of these practical and technical issues that come about with any idea to try and have some sort of certification on the basis of presumed immunity. And there's really several issues here. So just to be clear, what we're talking about is this would be the case where a person who has had COVID-19 and been infected with the novel coronavirus SARS-CoV-2 who have recovered. There's the idea that they could have some circulating antibodies in their system that could prevent them from future infection or reinfection. This is likely true. There likely is going to be some protection from infection if you have recovered from COVID. However, we just don't know how that might work and whether that's possible for everyone. So some of the major concerns really from a technical standpoint is this issue that really this virus has only been around, since the end of 2019. We don't know enough yet about how it works, and we don't know how immunity can be mounted against this virus. So for example, what kind of antibodies would be needed to provide immunity? What sort of levels you might need of those antibodies to be effectively immune? If everybody even mounts an antibody response. So it could be possible that some patients are able to recover from the virus with other sorts of immune processes that don't involve antibodies. And really, most importantly, we have no idea that if someone were able to mount an immune response with antibodies, how long those antibodies might last in their circulation to continue protection. There has been a recent paper, for example, that came out in Nature Medicine about a week ago or so, which was quite small. It only studied about 70 patients, but it showed, for example, that patients who were asymptomatic and that they didn't report any symptoms of COVID-19 had very low circulating antibody levels as opposed to those who did have symptoms. And when they did 8-week follow-ups with those patients, they did already start to see a decline in antibody levels. And so the question here is would immunity last for, as little as 2 months, perhaps, like the common cold, which is another type of coronavirus, or could it be longer? And really, at this point, we don't know. Another major issue when we're talking about initiating a program like this is that obviously, first you need to know if people are immune or not, if they've recovered. However, then you also have to assess whether those people may or may not have the antibodies to provide immunity, right? This is going to require a type of which is called serological testing, which means that it would require sort of the taking of blood of a person, checking to see if they have circulating antibodies to then say whether or not they may have immunity or not. This is where we have huge issues at the moment because there are some tests that have been developed to try and assess circulating antibody levels in people for COVID-19. And the issues that we're seeing is most of them are not sensitive or specific enough to give accurate results. So sensitivity would mean that you want to make sure that you have a test that can measure, even if you have low circulating levels, that they'd still be able to measure for positivity. And specificity means you want to make sure you're only finding antibodies against COVID-19 and not say maybe other viruses, which if you don't have a highly specific test, this could result in false negatives, meaning that people might be thinking they aren't immune when they could be. And if you don't have a sensitive enough test, this results in false positives, which is a very challenging public health concern because you could have people moving about society as if they are immune when really they aren't. So this is a huge issue. It's a huge issue in the US, for example, right now. The FDA has approved 21 different serological tests for emergency use authorization, and they have a huge variability in their level of specificity and sensitivity. So some are adequately sensitive and specific in that they have over 99.8% specificity and 100% sensitivity, and that's great. But some of them have as low as 88% sensitivity. Meaning that you would only have 88 of 100 tests being actually accurate. And so that's very concerning. This becomes even more concerning if you have low prevalence in a population. So if you only have a population that only has like 5% of people have recovered from COVID-19, and you have a test that only has 88% sensitivity, that can result in as low as 55% accuracy when those test results come back. So this is a huge issue in that we don't have the possibility right now to be able to test whether people are immune or not effectively or not. That being said, there are a few manufacturers that are sensitive enough. Roche has one test, Siemens has another. And this is where we get into another kind of more practical issue, is that if entire governments are thinking of rolling out these sorts of policies, right? You want to make sure, of course, that you're going to have access to immunity testing to ensure that people can be able to say whether or not they could be immune through a passport. So if you have a country like Germany that has a population of over 80 million people, you're going to need at least 160 million tests. Right now, for example, Roche is only producing 60 million tests a month, which is a lot, but that's not enough to test everyone in Germany. Nowhere near enough to test everyone in the United States. And so there's a real issue there of, of testing numbers. Another really important issue I think that we really need to consider too is just really the prevalence of COVID-19 in the population right now. So if this is going to be a situation where certain people have recovered or are going to be able to experience freedoms where the rest of the population are not, or are going to somehow be able to reopen the economy by going back to work and shopping and doing all these things that our consumer-driven economies depend upon, you're going to need to have some people that are immune, right, and have been tested for immunity. Right now, it's estimated that there's only 0.1% of the entire global population has been documented to have recovered from COVID-19. It looks like generally when we go across different geographies, prevalence of COVID-19 ranges from around, between 2 to 3% and maybe up to as high as 20 or 25% in certain hotspots like New York City. But on average, most populations are going to be floating right now around sort of the 5 to 10% of people who have had the virus. And so Francoise and I really argue that, getting 5 to 10% of the population, back to work or back into restaurants and cafes or shopping or traveling really isn't going to have the economic benefit that these governments are arguing that it could. And so that's sort of some of the practical and technical issues that we find concern with. And I'll swing it back to Francoise to talk about where some of these ethical issues actually come in part because of some of the limitations in numbers of tests and other things like that.
So thanks, Natalie. One of the things that for us is really important was to kind of be able to document based on what we knew about the science, what we knew about how people work, et cetera, whether or not this was even a reasonable idea. And so we basically say, we actually don't even think it's really a smart idea, even if you're just looking at the science and the data. But then we wanted to go further and say, maybe in some other possible parallel world, all of these practical problems could be addressed. And it really did make sense from some kind of technical practical perspective to embrace this strategy. We wanted to say, hold on, there are huge ethical problems that ought to give everyone pause and to think about really, is this something we want to do? And in that context, we tried to highlight a number of very real problems. Now, obviously, we're projecting into the future. We don't currently have immunity passports, but we see a lot of energy, a lot of time, a lot of talent, a lot of money being directed at this. And so we would argue from an ethical point of view, it behooves us to imagine what this future world might look like. So one of the things we start off with is talking about what does it actually mean to give up some of your privacy? And so the question there is, how much would you be giving up? And who would you be giving it up to? And for how long? And for what purpose, etc. And so in some sense, we have the idea that this might sound like a worthwhile trade-off in the middle of a crisis. But what if you actually thought that this is really just a platform? This is just the beginning. And we know that when we introduce policies and practices in times of crisis, they tend to stick around, right? And, we had a shoe bomber once, and now all of us take off our shoes to get on the planes, or at least we did when we were traveling, right? So I think that's one of the first things we're asking people to think about. Really, do you want to trade your privacy? And as I said, have you thought through the consequences of doing that? A second thing that we're really concerned about is the belief we have that this would have a disproportionate impact on certain segments of the community, specifically a number of different marginalized communities. And one of the examples we give, and in the United States, it would come under the banner of stop and frisk. In my country, it comes under the language of carding. But these are people who, for all we know, are law-abiding citizens out there in the world who are stopped, and they're asked to identify themselves, and information is taken from them, etc. Well, we imagine that this could become just one more reason to stop potentially law-abiding citizens walking around in the world doing whatever it is they choose to do, but who could be arbitrarily stopped and asked to produce this kind of identification. The concern there actually expands beyond just who might be stopped because they do or don't have the right kind of paperwork or the right kind of digital app, to actually step back and think, well, who would even be able to get access to this in the first place? And if we look at the testing that has been made available already, now not this kind of serological testing, but the testing to actually see if people have the virus. So these are two different kinds of tests, testing for the virus versus testing for antibodies. But we do know, and we have good data in terms of testing for the virus, that wealthy, privileged celebrities, sports stars, wealthy people, etc., have had greater and easier access. So we think, well, if it happened there, why wouldn't it happen here with this other kind of testing, such that you would now put barriers in front of people who may not be able to access the test in order to get the right kind of documentation. And in many cases, this test is not going to be available for free. So, you know, maybe you're wealthy enough that you can afford it. Maybe you work for an employer who will afford it for you. But what if you're in the gig economy? What if you're a part-time worker? What if you are self-employed? This now becomes an additional expense. And what if you're not employed? What if you're, a homemaker? What if you are a person living on the streets? What are all the other kinds of ways in which people, certain segments of society might in fact be disadvantaged? And I think Natalie and I then push that even further, and we really talk about creating a bifurcated world of the haves and the have-nots, those who are able to get access to an immunity passport and able to hold on to it, versus those who, for any number of legitimate reasons, might not be able to get access to that. And so we think very much about that kind of social stratification. And at one point, we talk about this in terms of the immunoprivileged and the immunodeprived. And I would say to you, historically, it has never worked out well for people when we try to divide the world in two, right? Because by and large, it turns out into situations where a significant section of the population is disadvantaged. More generally, we anticipate new forms of discrimination, and that takes us back to the very first point. If you're thinking about this as a new platform, what are all the other kinds of information that you'll be asked to include on this health certificate? Because that's what we imagine it becoming. You know, you're not going to have an immunity certificate and think about, again, all of the work, the time, the money, the talent to develop this. And then in a few years, we're just going to throw away this technology. I can't imagine that world. The world I imagine is we're going to say, oh, we could put all of your other vaccines on that app. Oh, we could put all of your health data. Don't you want to be able to always go to the doctor and just have your whole health record on this app? Or what about, you know, that genetic test? Did you do some ancestry tracing sometime? Why don't we put that in there as well? Maybe you've got life insurance, maybe you've got health insurance. And we can just imagine the way in which this app could really become very difficult for many people in terms of sort of state oversight. And the last thing I want to say before I sort of turn it back and open it up is I think we need to be thinking about alternatives, because this particular proposal actually represents a threat to public health. And I think what's important to appreciate here is public health officers around the world in different countries through ministries of health, et cetera, have been trying to educate people about a number of measures, public health measures they can take to protect themselves and to protect others. Immunity passports, because of the way they're intended to function, where, as Natalie explained, you presumably have been exposed to the virus, you've gotten COVID-19, you've hopefully recovered, and now you hopefully have antibodies. Well, think about it. You now have a perverse incentive to go out and get yourself infected. If that's your ticket out of jail, right, if that's the only way you can get back to some semblance of a normal life in terms of being able to work, being able to go out and socialize, being able to travel, you have now structurally created an incentive which undermines everything public health has been teaching us. And that's a huge problem, because we are being told, and we have reason to believe, there will be a second wave. If there's a second wave and we're told to go back to the measures that we have been trying to live through for the past couple of months, why would anybody do that? Why would anybody listen if at the same time you've created this incentive to go out and get yourself infected? So I'm going to stop there and open it up maybe for questions or comments, Alan.
Thank you so much, Francoise and Natalie, for those very thought-provoking comments. I'd like to forward to you a first question. This comes from a member of the University of Oregon History Department, Arafat Valyani, who is going to be a resident, one of the resident scholars at the Wayne Moore Center next year. He asks, how does the conversation about immunity passports intersect with the debate about racial justice, policing and surveillance, which is currently very visible in the US as well as around the world in the form of the movement for Black Lives? And a number of the comments that you've made already have touched on that. But could you pick that up and address that?
Yeah, I can take that. I'm really grateful for that question. It's an important one, and it's something that Francoise and I have discussed at depth about. I think that what's been concerning to us, actually, and to sort of show you and frame the discussion that's going on right now, is there have been proponents of immunity passports who have made this argument that because certain communities of color, particularly Black Americans, have higher prevalence, have shown higher prevalence of COVID-19 infection within their communities, that somehow an immunity passport could actually benefit those communities. And we find this to be a very twisted and naive sense of logic, in part because it overlooks the sort of the structural racism that's already existing in this country that has led to this disproportionate health disparity. And we think that there's absolutely no reason to believe that those same disparities wouldn't play out with an immunity passport. So some ways that we've been thinking about that, of course, is, as Francoise has already alluded to, in the policing space. This again would provide one more reason to stop law-abiding citizens. If we look at data, say, from New York City, over 80%, 88%, I believe, of people who were stopped and frisked in New York City last year were either Black or Latinx. And so this provides one more reason for people to be stopped. It also provides a way, actually, for police to survey entire communities. So as we've discussed, if these immunity passports were to be expanded beyond to this digital health passport system, which is linked to people's cell phones, so most of it would be held in a cell phone app, thereby linking it to their location, linking it to who they may come in contact with, you could be able to use these sorts of platforms to actually monitor entire communities of people, monitor who they're interacting with, where they're going, where they're shopping, their advocacy roles and their protesting actions. So this is also really, really concerning to us. Secondly, from a travel standpoint, we already know that certain groups are already discriminated and racially profiled at the border and in different security checks in airports. This is in part because border patrol agencies are actually exempt from federal law that makes it illegal for law enforcement to discriminate or racially profile. And so again, we could see this as being a situation where actually, because of higher prevalence in certain communities and communities of color, specifically in the United States, they could be stopped or sort of harassed at higher levels at borders. It could also serve as a really kind of gross proxy for discriminatory immigration laws. So for example, if we know that there's higher prevalence in certain countries, the US, for example, could use that as a reason to either mandate that nationals from those countries have to show proof of immunity before coming. So for example, we could see maybe Chinese nationals needing to show proof of immunity where perhaps Greek nationals might not have to. So these are really big concerns for us. I also wanted to turn it over maybe to Francoise, who could also speak more about the way that immunity passports could actually really harm Black lives, whether it's in America or Canada or elsewhere, in the space of work as well.
Yeah, so I guess I'd like to just add another comment along those lines, which actually really is an effort to look at problems that we refer to in academia having to do with intersectionality. And so you have to pay attention not just to racial and ethnic groups and how they do or don't get identified, but also to their socioeconomic status. And the reality of it is that many people, and many of us here listening to this or participating in this, are really very privileged. A lot of our work is computer-based. A lot of us have been able to safely stay in our homes, continue to work, and do most of what we find enjoyable or important. Many people, their livelihoods depend upon going out and getting back to work. In many cases, as I've said, this could be a barrier in terms of even just getting access to the certification. So they might well have been unlucky enough to already contract the disease because they've had to go out into the workplace in order to keep being able to put a roof over their head and food on the table. They've been unlucky, they've contracted the illness, they actually have antibodies, but they can't actually get access to the right kind of certification to be able to show this. And so now they're doubly harmed. They're harmed in terms of their health, but they're also harmed in terms of their ability to participate in the economy. And this is the very thing that the passport is supposed to help achieve. So I think, there are many ways in which we need to think about who's doing which jobs, who ultimately would be helped or harmed by these kinds of policies, and how you do or don't get access to the requisite documentation. I mean, we've talked about these being digital passports. Not everybody has a smartphone, and yet that's the context in which a lot of this technology is being discussed.
And just one other thing, not only getting access to being certified, but also holding on to that certification, right? So that might require multiple time to keep being recertified. So there's another barrier. And also, we also know, for example, there's data that came out of LA showing that Black and Latin drivers are more likely to have their licenses suspended and revoked or taken. And so again, there could be situations where certain communities of color also are unfairly targeted to even be able to maintain their certification.
Okay, thank you both. I do have a number of questions here. One of our participants asks whether you think such passports might potentially violate US constitutional amendments, the 4th and the 5th, in particular against unconstitutional, that's a search and seizure, for example. Any ideas about that?
Well, so I went onto Twitter a few weeks ago and sort of was like, lawyer friends, tell me the legal implications of an immunity passport, because I'm not a legal expert, and neither is Francoise. So one, I didn't get so much into ideas around the seizure of certification, but one thing that did come up were American Disability Acts. And how somehow this could play into the idea of an immunity passport. So again, employees being allowed to mandate whether workers could or could not work based on some sort of health data. And so there wasn't anything that came out clearly that could implicate some of that in stopping the program from moving forward. If anything, it would be something that would almost happen after the fact, where you could have legislation come up afterwards. But I didn't find out very much about that. But again, I am not a legal expert, so that is not a good question for me.
Well, actually, I could just add that another participant has some commentary and a question precisely on this issue about the Americans with Disabilities Act. In light of a ruling, I gather, that I don't know anything about, but that you may, from the Equal Employment Opportunity Commission fairly recently, like within the last week, saying that an antibody test may not meet the ADA's requirement for business necessity or job-related tasks consistent with business necessity, which is a standard for medical examinations or inquiries, health-related inquiries made of current employees. And this participant would like to know what you know either about those ADA standards or this very recent guidance from the EEOC.
I
have a phone call lined up with my lawyer friend tomorrow, but I don't know the answers yet. I'm sorry.
That's the one thing I would offer is we do have a colleague, Seema Mohapatra, who has done some work in this area, and she has published in The Conversation. So I think if you were to put her name and The Conversation into Google, you would be able to find that. So there are other people with that kind of expertise, but I think from an ethics point of view, one of our concerns is the way in which something that looks objective would in fact be used in ways that are discriminatory. So if you do not want to hire a person because you think that they have certain disabilities, et cetera, but you know you're not allowed to do that, well, you might then try to create other barriers that look objective. If you can say, oh, it has nothing to do with that, it's all about the fact that you don't have immunity status. It's nothing to do with your color, it's nothing to do with your education, it's nothing to do with your ableism, nothing to do with your sexual orientation, all of the things that you should not overtly be discriminating against. We worry that you would then use this, which looks like some objective matter of fact, some health data, to actually cover for that kind of unacceptable discrimination.
Mm-hmm.
Okay, there's another question about herd immunity in relationship to this. I wonder if you could comment on that.
Natalie, do you want to start? And
sure. Yeah, I mean, so here, herd immunity is, for the
Okay, I'll take over.
Or just in the short term, that event. Oh no. I don't know. Am I back?
You're back.
I don't know. Okay, sorry. I don't know where you lost me.
At the very beginning.
Okay. So herd immunity is the idea that at a certain level, once enough people in the population have recovered from the virus and hopefully have antibodies to protect from future infection, that you get to a high enough level of protection in a community that then you wouldn't have the issue of having such high infection rates and people being at risk. This is what vaccines try to do, is raise herd immunity through vaccination. Immunity passports are actually being proposed as sort of this interim way, before a population either reaches herd immunity, either through either through getting infection and recovering, or once a vaccine is developed and distributed, that an immunity passport is this way that in the meantime, certain people who may have immunity could then move freely through the community, if that I think answers the question. So that's how it fits within sort of this idea of it's during, while we wait towards getting herd immunity, either through a vaccine or through high enough prevalence in a population of infection. Because we're nowhere close to herd immunity now, to be clear.
Yeah, and also I think it's important to say there has been a little bit of a debate as to how high the percentage of the population would have to be in order for you to think that you have effective herd immunity. And part of that also has to do with knowing how long that immunity is going to last. Mm-hmm. And so one of the things that I would say is really important in this conversation is to have the right amount, if you will, of humility. We don't know anywhere near enough about this virus, how it works, how we get immunity. We really don't know when and even if we will get a vaccine. And so I think it's in that context that we do want to find ways of getting the economy open, people getting back into certain kinds of routines, both for their mental and physical health. So we understand the goal of the people that are pushing these immunity passports, but we're thinking there are other ways that we need to move forward in pursuit of those very good goals that we agree with.
Excellent. I just want to add that we did have a comment from a participant who is an attorney, Caitlin Oldham, who says that immunity testing would not violate the 4th or 5th Amendment because it's a voluntary test and is not compelled. I suspect the issue is whether employers would in fact require this kind of thing in order for employees to return to work. And I'm sure that there will be legal conflicts over that.
But I think travel.
Yeah, that's where I was going to go. We need to think about this globally, because if you take the example of travel, let's say, for whatever reason, my country, Canada, decides, Francoise is right, this is unethical, we're not going to do it. And maybe, Natalie and others persuade the US, no, we're not going to do this, it's unethical. If everywhere in Europe says, that's fine, but you can't come into our country without one, what are you going to do? And that's why we need actually to be having this conversation on a global scale, because we are interconnected. This is in fact a global public health problem, and we therefore have to come up with global solutions. And I think that's one of the reasons Natalie and I are really quite concerned, because we see huge disparities around the world, and we worry about the wealthy individuals, but also wealthy countries just kind of forging ahead without thinking about the fallout and the implications for poorer individuals and also poorer countries. I think it's really, really important that we pay attention to that, and that when we try to move forward, that we try to bring everybody forward together. So if the goal is to open up the economy, we want to do that in a way where everybody can participate. If the goal is to get people traveling again, we want to do it in a way that maximizes opportunities for participation. And again, if I go back to mental and physical health, we need everybody to get back out into the world.
I think one of the things that has been most revealing about this pandemic is that it has exposed both the level of global interconnectedness that we have had, and also the kinds of disparities both within and between countries that you're talking about. In spite of that, I think a very common response has been that we are all in this together. So if immunity passports are not a useful way of thinking about addressing mobility in practical terms, what kinds of policies do you think might address the reality of the kind of unequal vulnerabilities that you've been describing?
Well, I think that's a critically important question. And I think what that does is it forces us to have to address the specifics, but also the broader social structures that have gotten us to where we are today. And so if we were looking at the specifics, a part of me would be saying, think about all, and the language I use is time, talent, and treasure that you would have to invest into developing these kinds of immunity passports. And I'd be saying, there are huge opportunity costs. Take that same time, talent, and treasure and do something that's good for the world. So one of the points I made earlier is that, you're creating this perverse incentive for people to go out and get themselves infected. Well, some of them are not going to recover after they get infected. I mean, we have to remember there is a real loss of life associated with this. Some of them individuals who will recover will be seriously compromised. I mean, we don't know yet enough what it is that we mean or think when we just sort of in a very cavalier way think, oh, well, we'll go and get ourselves infected, as if we're talking the chicken pox and things will be fine afterwards. So I think what we're looking at is to say, let's pay attention to the public health measures that we know work, right? We have good evidence that they are effective. We know that there are limits for that, so we have to invest in developing vaccines. We know that there are limits in terms of the underlying health conditions that people come to the current situation with. So we need to improve the health of all peoples around the world so that their baseline doesn't put them at a disadvantage. We are already seeing in terms of the illness that discrete groups are really disadvantaged. And it's not because of some genetic underlying condition, it's because their general health condition is not acceptable. We need to seriously talk about working conditions. We need to ask, why is it that people don't stay home when they're sick? Well, if, I'm going to come into work because I have to put food on the table, I'm not going to be thinking about the people I might be infecting. Whereas if I have the ability to stay home and still get my salary because I have paid sick leave, it might make a difference. So I think we really need to look at all of the structures that are in place that will support good decision-making. And for me, good decision-making is decisions that will keep you safe and healthy, and that will allow you to make decisions that will help you not infect others. So I think you really need to look at the two levels.
I think you also need to, I just wanted to make mention too of environmental health as well. And this has come out a lot with this pandemic, as well as different communities and neighborhoods being exposed to different pollutants in our environment in disproportionate ways. And so I think we also need to be giving a lot of consideration both to our inside environments, the homes that we live in and what we have access to, as well as to the greater environment. And just to add to that, I think something that Francoise and I have talked a lot about too is partly why we have such dis-ease when we think dis-ease, not disease, dis-ease when we think about immunity passports, is that it's really premised on an ethic of sort of autonomy in the individual, right? It's like, it's not fair, and this is the arguments that are used, right? It's not fair for an individual to have to stay home and continue to practice certain physical distancing rules and other rules that are limiting other people if they are immune and aren't a threat to people. So that's the argument for immunity passports, that those individuals should be allowed to move freely, since that wouldn't be fair to restrict them. we really think that this is partly what's gotten us into a lot of the trouble that we are in already, is this hyper focus on the individual, and really that we need to be shifting towards a focus on social justice and the collective. And an immunity passport in many ways is in direct conflict with an idea of social justice.
Yeah, and I think, you know, the other term that we've also used in some of our writings is this notion of solidarity. You know,
Yeah.
what does it mean to have solidarity? And that's not just with, you know, a narrow group of people that you think are just like you. It's with all of us and what we have in common. And I think one of the things that, you know, it's been difficult to kind of get across to the general population and even to governments sometimes is that this is a global problem. And if you think you can fix it within your borders and everything will be fine, you haven't understood what kind of a public health challenge you face. Because even if you can control your numbers and you can get your herd immunity up within your geographical borders, which are human-made borders, right? They're not there for the virus to recognize and say, well, I'm not walking across that border. You've actually achieved nothing at the end of the day because you're still at risk.
Okay, we have a question about vaccines. Anthony Fauci recently publicly expressed cautious optimism about the results of ongoing vaccine trials.
Yeah.
Given what especially Natalie said earlier about how little we know about COVID, about antibodies, potential immunity, the longevity of the virus, and so on, how should we be thinking about this?
Yeah, that's a really good question. So some of the most advanced vaccine trials right now are going on out of Oxford, actually in London. And some of where the optimism is coming from is that they did some trials in non-human primates and showed that vaccine could protect against reinfection. And they were able to show, and this is where I think the question is based on, they were able to show that when they gave the vaccines, these monkeys were able to develop antibodies against the virus, right? And thus hopefully have immunity. Of course, if we don't know how immunity works against the virus, or if we don't have good tests for immunity, that could obviously become a problem in those types of studies. So really where they're moving towards now is they have small cohorts of trials now happening in human volunteers, where they will be giving those study participants a vaccine and then allowing them to go about their normal life and then following up to see whether they become infected. And in that way, it kind of does get around this idea of having to actually like measure and study immunity. You can just show that if someone's had a vaccine and they have a reduced likelihood of getting infection when they move about the world, then you hope that that would be an effective vaccine. That being said, it could be challenging to understand how long those vaccines could be effective for. And hopefully as vaccines develop, our knowledge and understanding of the virus and its immunity against it will be developing concurrently as well.
Yeah. And something that I would add is that I think most people are convinced that we're looking at vaccines, plural, that we're going to need a number of different vaccines in order to move forward in any kind of a timely fashion. Yeah. And I can tell you that the next set of worries that people like myself and Natalie will be really about issues of resource allocation and the distribution of the vaccine. Who will get access to this? And one of the things that's interesting is that you can imagine many countries wanting to do this on the basis of geography. So, you know, I'm at Oxford, I did this for the UK. Oh, I'm at Oxford, but I also have a contract with AstraZeneca. So whatever they've got, you know, commitments to those countries, well, they'll get access, privileged access. We also see a number of countries trying to get into the game of vaccines so that they can have a homegrown vaccine. And I think one of the things that becomes important is, how are you going to actually think about this again beyond borders? What are the risk profiles that you should be looking for in terms of who should get access? And I think in the early days, people will, I think, be easily persuaded that priority should go to healthcare providers, persons in nursing homes, et cetera, which are high risk, high density settings. But once you get beyond that, who's next in line and on the basis of what? And I think that that is really important. And if you can understand and see that, in effect, we just have the same question earlier on if you go with this idea of immunity passports. Who really is going to get access and on the basis of what kinds of criteria and considerations?
that being said, if I could just say, I do feel some optimism in that I have seen, you know, a lot of companies have really promised that they will sort of keep their manufacturing capabilities open and ready until for the first effective vaccine is shown, so they can really start ramping up production. So, you know, I hold on to some hope that there will be sort of this concerted effort to try and get as much produced as we can once we have.
I think that's true. And I think the WHO has started with these idea of the solidarity trials. But again, if you're actually looking at vaccines, you've got to think beyond just the science and finally understanding enough to think that you know how to give an effective vaccine. You've then got to get a GMP grade vaccine. You've then got to get it into manufacturing. You've then got to get it transported to the right people. You've then got to get it into the arms of individuals. We have huge challenges before us. And I think I'm just wanting to say we need to really now be thinking through all of those challenges. And, you know, the overarching thing is going to be then, again, the question of equality. How do we make sure that they're available in some kind of an equitable fashion to those who need access? I mean, the goal would be to get everybody vaccinated. There will, of course, be some who, you know, go under the banner of vaccine hesitancy, who will refuse to be vaccinated. And, you know, we will be hoping to get herd immunity without those individuals. But even so, we're nearly 8 billion people. How long do you think it's going to take to get everybody lined up so that you can give them a vaccine? We have a huge challenge before us.
Okay, I think we have time for perhaps one more question. And there's an interesting one that I hope I understand from Ramon Alvarado, who I believe is a philosopher who works on issues related to data science. He comments that there's this gets us back to the immunity passports. A lot of emphasis on the term immunity has to do with biological immunity, but the concept of the immunity passport in the tech industry, where people are actually working on developing apps, is more broadly applied to things like tracking risk of contact or infections of individuals. Some apps are being modeled after initiatives in which Ebola was the problem to be solved, and they seek to inform not only policymakers and health authorities and governments, but individuals as well. If you could show that the concept isn't about immunity only in a biological sense, and there aren't quite as many issues about privacy, are there other things, I hope I'm getting his question right, are there other things that you see as fundamentally problematic about immunity passports as well?
Well, let me just jump in and say we need to be really careful, though, because it seems to me that there's two kinds of technologies that are being melded. So yeah, there's overlap in terms of some of the AI, but contact tracing has a different goal and objective than immunity passports. And Natalie and I have, you know, said before, we think contact tracing is something that's very important and positive and should be done, but that comes under the banner of the normal public health measures, right? And so you're trying to get people to practice social distancing, you're trying to have them live and work in smaller bubbles. And part of the reason you do that, and we've had this idea introduced, is so that, you know, you can remember who you were with, such that you can do that. And there are ways in which governments have been exploring both decentralized and centralized options. And what's been interesting there is that the tech industry has gone for decentralized options. And that's certainly something that we would be supporting, because that would fit with our concerns about, you know, having a government database, having all of this information about its citizens. But I think I'm just wanting to underline that for us, there's a really big difference between contact tracing and, you know, the AI that's required to do that and the immunity passports. I see Natalie wants to get in.
Yeah, let me in here. I think also sort of what Ramon is alluding to as well is, sorry, the sun's setting, so I'm getting like bright in my eye. Is that these are some of the apps that are being used in China right now in some ways, right? So these health status apps, right? So they're basing it on sort of who you've come in contact with your likelihood of having the disease or being ill or having immunity. And so in a lot of ways, the same issues arise for us if, for example, if people are still being restricted or limited of where they can go or what they can do on the basis of some sort of health criteria, whether that's immunity, whether that's the likelihood of health status of COVID-19. These are really concerning for us, and it doesn't really eliminate the ethical issues around the social stratification that could occur from that. It might help with some of the privacy issues, but not the ethical issues. One thing I wanted to put out there that I think has been a really interesting thing that Francoise and I have been on some conversations on are these sorts of ways where individuals could make choices for their own selves and their own safeties based on locations. So you could have anonymous data on certain stores or certain malls or restaurants where you could know whether there's people that could be of higher risk or not of COVID-19. And then you make that decision for yourself whether or not you want to enter into those premises. And that might be a way to empower people and give them some more individual autonomy in the decisions that they're making, but not be restricting to certain individuals or not from entering certain locations.
Thank you, both Francoise Baylis and Natalie Kofler. We so appreciate your contributions to this important conversation. And thank you everyone out there who participated by asking questions and by actively listening. The Wayne Moore Center will be organizing more of these remote public events in the weeks and months to come. So please stay tuned. Keep a close look on your email box for announcements of those. We hope you will join us again in the future. Thanks, everybody. Stay healthy and safe.
Thank you.
Bye.
Bye.
Thank you. Thank you.